Hi, my name is Linda Zhang and I'm a gastroenterology fellow at St George Hospital in Sydney, Australia. Our department runs a quaternary level service to provide multidisciplinary care to a wide range of patients with swelling disorders. On behalf of all of my co-authors, I would like to thank Gastrointestinal Endoscopy for the opportunity to present our paper titled Clinical Utility of Cricopharyngeal Distensibility Measurements During Endoscopic Myotomy for Zenker's diverticulum. So Zenker's diverticulum is a rare condition, characterized by herniation at Killian's dehiscence. Although it was first recognized more than 200 years ago, its pathophysiology is still debated. Our current understanding stems from indirect measurements taken during studies more than 20 years ago, in which a combination of manometry and videofluoroscopy demonstrated reduced cricopharyngeal distensibility and increased hypopharyngeal pressure during swallow. The mainstay of treatment is through a cricopharyngeal myotomy, and this can be performed either transcutaneously or endoscopically using either rigid or flexible instruments. The flexible endoscopic method is rapidly emerging as a potentially safe and effective first-line treatment for moderate-sized Zenkers. What is striking, however, when reviewing the literature in this regard is the wide variation in myotomy technique across institutions. And we feel that this is a huge contributor to the variable relapse rate of up to 24% quoted in current literature. In addition, endoscopists often find difficulty finding the perfect balance between performing an adequate myotomy and reducing the risk of perforation. And this led us to wonder whether there could be a real-time intraprocedural indicator of myotomy adequacy. Speaking of intraprocedural indicators, the Functional Lumen Imaging Probe, or FLIP, is a flexible balloon-mounted catheter which allows direct measurement of lumen distensibility. Our group has previously validated its use at the lower esophageal sphincter, and recently it has also been used to evaluate pathologies at the cricopharyngeal muscle. And this places FLIP in a unique position to tackle some of the technical challenges facing endoscopic myotomy for Zenker's diverticulum. We modified our catheter by placing suture loops at non-functioning points, and this allows us to pass our catheter safely over guide wire such that the balloon is positioned over the cricopharyngeus. We can then distend the balloon and obtain readings for pressure and narrowest cross-sectional area, allowing us to evaluate the dynamic pressure-volume relationship and to generate a distensibility curve. So with this in mind, we sought to fill some gaps in current Zenker's knowledge, and we designed a pilot study with two main goals. Firstly, we hope to directly confirm that Zenker's patients have reduced cricopharyngeal distensibility when compared with controls. And secondly, we hope to demonstrate the safety and feasibility of the intraprocedural use of FLIP to determine myotomy adequacy. And so we performed a prospective parallel cohort study. We enlisted 11 symptomatic, treatment-naive Zenker's patients scheduled to undergo flexible endoscopic myotomy at our institution. We additionally enlisted 16 healthy, non-dysphagic subjects scheduled to undergo routine diagnostic gastroscopy at our institution. First, we sought to establish safety, and so for our initial cohort, we adopted a conservative approach and performed a single-step myotomy with pre- and post-distensibility measurements. The procedure was then terminated at that point, regardless of the outcome at the post-myotomy distensibility reading. We then sought to establish a proof of principle that FLIP is indeed a sensitive and meaningful gauge of myotomy adequacy. And so for our subsequent cohort, we adopted a multi-step myotomy technique. We set a threshold for a so-called adequate myotomy, such that if patients did not meet this threshold, they had extension of the myotomy during the same procedure. A final distensibility measurement was then performed before the procedure was terminated. Our study is unique in that we were able to directly assess what had previously only been shown via indirect measurements. We were able to confirm that firstly, Zenker's patients do have reduced cricopharyngeal distensibility when compared with controls, and secondly, that this reduced distensibility is reversible by cricopharyngeal myotomy. Furthermore, in our multi-step cohort, we were able to show that additional muscle transection during the same procedure was able to result in significant improvements in distensibility. Our study was not designed to assess efficacy, however we did see a clear association between distensibility measurements and short-term symptom improvement. Only one of our 11 patients did not show a marked improvement in symptom score, and this patient was one of the initial cohort who was only allowed a single-step myotomy. None of our patients who were allowed a multi-step myotomy experienced treatment failure, and we saw no significant complications during our study. Our study does have some limitations, and these are discussed in more detail in our manuscript. Specifically, we did have a small sample size and limited follow-up duration. In addition, our threshold for an adequate myotomy was based on our prior experience with the intraprocedural use of FLIP during treatment for achalasia. This has, however, not been validated in Zenker's diverticulum. Our study has a number of important implications. The ability of FLIP to quantify myotomy-induced changes in distensibility demonstrates its feasibility as an intraprocedural tool. This is absolutely fundamental towards standardizing myotomy technique and hopefully reducing relapse. Our study is only the beginning, and future studies are needed to correlate these distensibility measurements with longer-term clinical outcomes. In addition, further prospective studies are needed to both determine and validate threshold cutoffs for an adequate myotomy. I thank you very much for listening to me today and invite you to read our manuscript for more detailed results and analysis. Thank you.